Good morning, everyone. It's a pleasure to be here at my first I-ELCAP conference, and today I'll present current state of lung cancer in Central Asia countries. You are looking at 5 countries of Central Asia: Kazakhstan, Uzbekistan, Kyrgyzstan, Turkmenistan, and Tajikistan, with a growing population about 76 million people. And Kazakhstan is the only country with long-running national cancer screening program in breast, cervical, and colorectal cancers. Importantly, we already have experience of lung cancer from pilot project in 2018. Uzbekistan is planning national screening programs for breast and cervical cancers in 2025 in partnership with Republic of Korea. There are no reported national cancer screening programs in other Central Asian countries. Most barriers are city capacity, workforce, IT integration, and also financial. On this slide, you see age standardized rate, incidence, and mortality of common cancer sites across Central Asia countries. And for lung cancer, mortality closely mirrors incidence because most cases are still found late. And lung cancer ranks in the top 3 for incidence and mortality in the Central Asia countries and #1 cause of cancer death in Kazakhstan. According Global Tobacco Control Information and Statistics, overall smoking prevalence in Central Asia is higher than North America and Western Europe and lower than some Eastern Europe countries and East and Southeast Asian countries. Overall smoking average in Central Asia is roughly similar to world average. The table illustrates differences in tobacco control measures across 5 Central Asian countries, and quitting resources are limited in all countries and not covered or partially covered by government. Only Kazakhstan, Uzbekistan, and Turkmenistan have national anti-tobacco campaigns. Despite having a lower population density than other regions of Asia, Central Asian countries have consistently ranked among the most air polluted in the world. In 2021, a study measuring PM2.5 concentration in the largest cities of Central Asia revealed that the levels of PM2.5 exceeds the World Health Organization limits by 4 to 13 times. These numbers comes from the US Embassy air monitoring stations, so they are directly measured and not modeled. Also, radon represents a significant contributor to lung cancer risk in Central Asia, where radon exposure exceeds World Health Organization recommended target level, so especially in industrial and mining regions. The global map shows Central Asia shaded among high burden regions, indicating elevated death rates from air pollution, and compared with many parts of the world, reaching up to 113 deaths per 100,000 adults. Looking ahead, we expect the absolute numbers of new cases and deaths to rise. The chart shows estimated new cases growing from 2025 to 2013, with increases around 30% in Kazakhstan and reaching 63% across other countries. Estimated number of deaths follows the same direction. Here is the result of pilot project in Kazakhstan. In a multi-center study, 3,600 asymptomatic men and women aged 40-75 years, regardless of smoking status, were enrolled. All CT scanners used low-dose CT protocol. Interpretation was according to Langrad. The overall cancer detection rate was more than 2%. And among smokers, it was 3.5%, and among non-smokers, it was 1.4%, which is also high for non-smokers. We stopped our pilot screening because of the COVID-19 pandemic. In April 2024, the first Central Asian Forum on Lung Cancer brought together international and regional experts to address lung cancer diagnosis and treatment challenges across Central Asia with focus on early detection and screening. I-ELCAP played a central role in organizing the conference and contributed its expertise in low-dose CT screening infrastructure, training, and implementation strategies as highlighted in this resulting publication. The forum catalyzed collaborative planning for lung cancer screening in Kazakhstan, which has since announced phased national implementation. The map also shows the number of CT scanners in different regions, which demonstrates the readiness of our country to carry out the large-scale implementation for lung cancer screening. The study will include 3 regions of Kazakhstan with high, medium, and low incidence mortality rates. In 2026, we plan to screen more than 24,000 participants, and in 2027, more than 36,000 participants. In the planned study, the inclusion criteria will be asymptomatic men and women aged 50, 79 years, current smokers, ex-smokers who have experienced 15 years and more. The interpretation will be performed per I-ELCAP protocol, and with one low-dose CT, we can detect early lung cancer and also report actionable lung findings, emphysema, osteoporosis, liver steatosis. In conclusion, lung cancer is the leading cause of cancer mortality in Central Asia, and organized low-dose CT screening in our countries is justified. Smoking cessation is necessary, but insufficient given high smoking prevalence and air pollution. Kazakhstan's low-dose CT pilot showed a high detection rate, including among non-smokers, confirming effectiveness and feasibility. With I-ELCAP protocols, training, and a digital registry, Kazakhstan will launch a phased national low-dose CT program in 2026 and serve as a regional reference center. Thank you for your attention, and a couple of pictures of my country, Kazakhstan, and also my city where I came from, Almaty.